So I'm here with my client Yetta, and she's been a client of mine for over 15 years now, and we're treating routine care for her. She's rheumatoid arthritis, history of rheumatoid arthritis, which has caused deformities in her foot. So her metatarsals, which are the balls of her feet, are really plantar flexed and they take a lot of pressure. It's also made it kind of difficult for her to do her routine nail care. So we definitely do her routine nail care and her calluses. She also has some claw toes, and those claw toes rub against the top of shoes and you get corns and calluses. So routine nail care for her and callus reduction is one of the main things that we do. So routine nail care is good because it helps to improve the nail health. It prevents injury to the other nails, and it also protects your hosiery and footwear. So because of the claw toes, we get lots of buildup of callus on the top part of her toe, and that causes pain and debilitation. So simply reducing the callus and kind of taking care of the corns will help in her comfort level. So some of the things that happen with rheumatoid arthritis over time is that you get changes in the foot structure. You can have rheumatoid nodules is one of the things that happens, but there's also a subluxation of the joints, so the joints become out of place. And in Yetta's case, what's happening is these ones are all moving laterally, and it causes this metatarsal here at the bottom to become prominent. As that happens, these toes become clawed. And so there's a difference between a claw toe and a hammer toe, in that a claw toe, there's still range of motion, but in a hammer toe, it's fixed. So in Yetta's case, there is a little bit of motion in the distal part of the toe, but the joint itself has become fixed. So I would say it's a hammer toe. In addition to that, it has a lot of callus on the apex, which is the tip of the toe, which indicates that it's in ground contact. So that means when she's walking, there's not much motion. This toe is constantly dragging on the floor. So it's now a hammer toe. So we're going to do the callus on the bottom of Yetta's foot because that has developed because of her second metatarsal being overloaded. So she also has a bunion. Actually, it's a bunion on both feet. And this has actually been surgically intervened. She actually had surgery on this by an orthopedic surgeon. And it's what I would consider probably something that didn't go exactly as planned. So the bunion is still here. So this first metatarsal is moving into the space of the second metatarsal, which now needs somewhere to go, so that's moving into the third and the fourth, and it's pushing everything over laterally. What's also happening is that as it's pushing and moving up, it's giving overloading here, so it's extra pressure on that second metatarsal head, and that's where the calluses are developing. So taking down her calluses regularly helps to improve her mobility, helps to decrease discomfort. Now you'd be inclined to think that taking down a lot of the calluses is a good idea, but it's not always a good idea because there's nothing there to protect that bone, that metatarsal head. So taking down enough to physiologically normal is better than over-reducing or under-reducing. So we just reduce the callus to the point of where she's comfortable, and then we get her a proper orthotic or proper footwear to help accommodate the foot structure and address the biomechanics of the foot.